The only 6 exercises you need to relieve neuropathy in feet and legs. The experience of tingling, burning, numbness, or a sensation akin to walking on broken glass is a disquieting one. And for a significant portion of our population, it's a familiar reality. It's estimated that 1 in 4 individuals over the age of 70 grapples with these unsettling symptoms, a condition often misunderstood. A common misconception is that a pharmaceutical solution is the only recourse. However, groundbreaking research emerging from the University of Utah offers a compelling alternative, demonstrating through microscopic examination of skin biopsies that specific exercises possess the remarkable ability to stimulate nerve fiber regeneration. These findings suggest that the body possesses an inherent capacity for healing and repair, accessible through targeted physical activity. This presentation aims to equip you with 6 straightforward, at-home exercises that leverage this regenerative potential. Remarkably, these exercises require no specialized gym equipment, only a comfortable chair and a commitment of approximately 15 minutes each day. To fully appreciate how these exercises function, it's crucial to understand the nature of your peripheral nerves. Envision them as intricate cables extending from your spinal cord to the furthest reaches of your body, including your feet and toes. These vital conduits are responsible for transmitting a constant stream of signals, sensations of pain, temperature, and proprioception, which is your body's awareness of its position in space. When these nerve cables become compromised or damaged, the integrity of these signals is disrupted. Instead of clear, coherent information, your brain receives distorted signals, a cacophony of noise, which manifests as the distressing sensations of burning, tingling, and numbness characteristic of neuropathy. The primary culprit behind this nerve damage is diabetes, a condition implicated in approximately 40% of all neuropathy cases. The persistent elevation of blood sugar levels can literally glue nerve proteins together through a biochemical process known as glycation, hindering their normal function. However, the causes of neuropathy extend beyond diabetes. Excessive alcohol consumption directly poisons nerve fibers and interferes with the absorption of essential nutrients like vitamin B1. Deficiencies in vitamin B12, particularly for individuals taking medications such as metformin or omeprazole, are also significant contributing factors. Other common triggers include chemotherapy treatments, autoimmune diseases, obesity, and, in a notable 30% of cases, the underlying cause remains elusive even to medical professionals. Regarding supplements, while the landscape can be complex, alpha-lipoic acid stands out with substantial scientific backing. Clinical trials, such as the Sydney and Nathan studies involving hundreds of patients, have indicated that a daily dosage of 600 milligrams can lead to a significant reduction in pain and tingling, often by 30 to 50%. Vitamin B12 also plays a critical role, and it is advisable to have your levels checked, especially if you are on metformin. Interestingly, vitamin B6, when taken in doses exceeding 50 milligrams per day, can paradoxically cause neuropathy, highlighting the importance of verifying the composition of your supplements. Detailed links to all cited research can be found in the description section below. Now, let us delve into the core of why you are here: the transformative power of exercise. In 2015, a pivotal study conducted by scientists involved taking skin biopsies from individuals with neuropathy before and after they participated in a structured exercise program. The results were not merely subjective improvements. The microscopic analysis revealed undeniable evidence of nerve fiber regrowth. New nerve endings were observed in the skin, a tangible and measurable regeneration. The question that arises, of course, is which exercises achieved such remarkable results. The following 6 exercises, categorized into cardio, balance, and footwork, have been meticulously chosen to facilitate this very process, all achievable within the comfort of your home and with the support of a chair. Cardiovascular exercise forms the bedrock of this therapeutic approach, serving as the catalyst for nerve regrowth, as demonstrated in the Singleton study. Without an adequate cardiovascular foundation, the benefits derived from other exercises are significantly diminished. The recommended target is 150 minutes of moderate intensity cardio per week, achievable through activities like brisk walking, cycling on a stationary bike, or swimming, any form of movement that is enjoyable and sustainable for you. The key is consistency rather than intensity. While many forms of cardio are readily accessible, it is beneficial to have an in-home option, particularly for days with inclement weather or when one feels less steady on their feet. To achieve this, sit upright in a sturdy chair, maintaining a straight back and avoiding reliance on the backrest. Begin by lifting your knees alternately, simulating a marching motion in place. Incorporate arm movements by swinging your opposite arm forward with each step. The pace should be such that your breathing slightly increases, yet you can still comfortably hold a conversation. Commence with 3 minutes of this seated march and gradually add 1 minute every few days, aiming for a total of 10 to 15 minutes per session, ideally twice daily. This regimen provides 20 to 30 minutes of daily cardiovascular activity with virtually no risk of falling. Cardio initiates the healing process, but a critical challenge in neuropathy is the impaired ability of damaged nerves to accurately sense the position of your feet. This sensory deficit is a primary reason why individuals with neuropathy are prone to falls, and the subsequent 2 exercises are designed to mitigate this risk, potentially preventing serious injuries like hip fractures. Neuropathy directly affects proprioception, your body's internal GPS system. When your ability to feel the ground beneath your feet is diminished, your brain receives insufficient data to make timely postural adjustments, leading to instability and falls. For individuals over 60, a fall can often result in fractures, the need for surgery, and prolonged periods of reduced mobility. To address this, begin by standing behind a chair, gripping its back for support. Shift your weight onto your right foot and lift your left foot just an inch or 2 off the floor. The objective is to hold this position for 30 seconds on each leg. If achieving this duration is currently challenging, even 5 seconds is an excellent starting point. Aim for 3 repetitions on each side. As you gain strength and stability, progress by removing one hand from the chair, then both. The ultimate goal for enhanced balance training is to perform these single leg stands with your eyes closed. This is where significant neural adaptation occurs, as removing visual input forces your body to rely more heavily on the compromised proprioceptive pathways, compelling them to work harder and become more responsive, much like strengthening a weak muscle through resistance training. Do not rush this process. Noticeable improvements in balance can be observed within 2 weeks of consistent daily practice. Next, stand with your feet shoulder width apart, one hand on the chair for support. Slowly shift your weight backward onto your heels, allowing your toes to lift slightly off the ground. Hold this position for a moment, then smoothly transition your weight forward onto your toes, lifting your heels off the floor, and hold again. Return to the heel down position. Perform 15 repetitions of this heel to toe rock, completing 2 sets. Maintain a slow, controlled pace. The emphasis is on deliberate movement, not speed. Each subtle rock sends critical sensory signals from your feet to your brain, reinforcing the message, I am here, I can feel the floor, I am in control. This single exercise effectively targets 3 crucial areas simultaneously. It enhances your balance, strengthens your calf muscles, and stimulates the sensory receptors in the soles of your feet, offering a trifecta of benefits. These 2 balance exercises, the single leg stand and the heel to toe rocks, require approximately 5 minutes to complete and should be performed daily. They serve as a vital safeguard against falls. Beyond balance, neuropathy contributes to the gradual weakening and atrophy of the intrinsic muscles within your feet, as the motor nerves that control them become less communicative. The following 3 exercises are specifically designed to reawaken these dormant nerve endings and revitalize your foot muscles. Exercise 4, calf raises with chair support, begins with you standing and holding the back of a chair. Slowly ascend onto the balls of your feet, holding the peak position for a count of 1 or 2. Then gently lower your heels back down, again with a controlled count of 1 or 2. Avoid letting your heels simply drop. Aim for a smooth, deliberate descent. Perform 12 repetitions for 2 sets, resting for 30 seconds between sets. The significance of this exercise for neuropathy stems from 2 key factors. Firstly, it strengthens your calf muscles, which act as a crucial pump facilitating blood circulation. Muscle contraction pushes blood upwards through your veins, and relaxation allows fresh blood, rich in oxygen, to flow down to your feet, nourishing your nerves. Secondly, each upward and downward movement transmits a proprioceptive signal from your feet through your spinal cord and to your brain, reinforcing the entire neural pathway from the sole of your foot to your skull. Once 12 repetitions become manageable, consider progressing to single-leg calf raises. This is a more demanding progression, so advance with caution. Exercise 5, towel scrunches, involves sitting in a chair with a thin towel laid flat on the floor before you. Place the ball of your bare foot on the edge of the towel. Using only your toes, attempt to scrunch the towel towards you. Practice spreading your toes, gripping the fabric, and pulling it closer. Repeat this 10 times for each foot, completing 2 sets. Initially, it may feel as though your toes are unresponsive. This is a perfectly normal sensation and, in fact, indicates that you are activating neural pathways that may have been underutilized. With each session, you will notice an increase in control and ease. Your brain is actively relearning how to command these muscles, utilizing the nerve fibers that remain functional. For an added challenge, progress beyond the towel by using your toes to pick up small objects such as marbles, pencils, or coins, transferring them from one pile to another. This advanced variation cultivates fine motor control in your feet. Exercise 6, ankle circles and writing the alphabet with your foot, begins with you seated. Lift one foot slightly off the floor and slowly rotate it in a circular motion. Perform 10 rotations in each direction, maximizing your range of motion. Feel the articulation of your ankle joint. Subsequently, using the tip of your big toe, write the letters of the alphabet in the air. Take your time with each letter, as each forms a unique pathway, engaging the muscles of your lower leg and foot from different angles. So, there you have it, 6 straightforward exercises designed to make a tangible difference. Now, let us integrate these into an effortless daily routine. One that is easy to remember and maintain without the need for complex notes. Aim for 15 minutes each day, divided into 3 distinct parts. Part 1 is your warm-up, the seated march performed for 5 to 10 minutes. This establishes your cardiovascular base, increasing blood flow and oxygen delivery to your nerves. Part 2 focuses on balance, the single leg stand, held for 30 seconds on each side, completed in 3 rounds, and the heel-to-toe rocks, 15 repetitions for 2 sets. These balance exercises will take approximately 3 to 4 minutes in total. Part 3 addresses foot strength and dexterity. Calf raises, 12 repetitions for 2 sets, towel scrunches, 10 repetitions per foot, and ankle circles, or writing the alphabet, 10 repetitions in each direction per foot. This final section will take about 4 to 5 minutes. Whenever feasible, and particularly when the weather is pleasant, supplement your home routine with a 20 to 30-minute walk at an easy pace. While this outdoor activity enhances overall benefits, it should not replace your dedicated home exercises. To ensure the efficacy of this routine, adhere to 3 fundamental principles. Firstly, start gently. If an exercise calls for 12 repetitions, begin with 6. If it specifies 30 seconds, start with 10. Nerves respond best to gradual adaptation, not sudden shocks. Incrementally increase the duration or repetitions each week. Secondly, consistency is paramount. 15 minutes every single day is significantly more beneficial than an hour once a week. Nerve healing is a slow but steady process, and consistent effort sustains this regeneration. Thirdly, inspect your feet after each session. Be vigilant for any blisters, red spots, or small cuts. When sensation is diminished, it's easy to overlook minor injuries that can escalate without notice. A simple 1-minute check can prevent potential complications. The scientific consensus is clear. Nerves possess the capacity to regrow. This is not conjecture, it is a documented phenomenon. Therefore, these exercises are not mere suggestions or optimistic hopes. They are grounded in evidence-based practice. Their power lies in their simplicity, requiring only a chair, 15 minutes daily, and unwavering consistency. Complementing this exercise regimen, it is advisable to have your vitamin B12 levels and blood sugar checked and to discuss the potential benefits of alpha-lipoic acid with your doctor. A diet rich in fish and leafy greens while limiting sugar and trans fats also supports nerve health. Neuropathy, while a significant challenge, is not an insurmountable obstacle. You now possess a tangible plan to confront it. If you found this information helpful, please consider liking this video, which aids in its dissemination to others seeking similar solutions. Subscribe for more in-depth breakdowns of health and wellness topics. We encourage you to leave a comment sharing which of the 6 exercises you plan to try first. Every comment is read and appreciated. Crucially, consult with your healthcare provider before initiating any new exercise program, especially if you have foot ulcers, significant sensory loss, or severe balance issues. All scientific references supporting the claims made in this presentation are conveniently located in the description below.